Hello, students. In this episode, we will learn vocabulary about death and dying. Please review this episode several times to ensure you know the vocabulary well. Module 16, Death and Dying. Statement of Purpose. The nurse assistant is introduced to the various stages of the grieving process and physical signs of approaching death. This unit introduces death as a normal stage of life. The healthcare provider must recognize the physical, psychological, and spiritual needs of the patient/resident during this period to understand coping mechanisms and provide support to the patient/resident and family members. Performance standards, objectives define key terminology. 1. Acceptance. 2. Advanced directives. 3. Apnea. 4. Anger. 5. Artificial hydration/nutrition. 6. Autopsy. 7. Bargaining. 8. Cachexia. 9. Cheyne-Stokes respirations. 10. Denial. 11. Depression. 12. Do not resuscitate, DNR. 13. Durable power of attorney. 14. Hospice. 15. Living will. 16. Morgue. 17. Mottling. 18. Palliative care. 19. Patient Care Self-Determination Act. 20. Post-Mortem care. 21. Prognosis. 22. Reminiscence. 23. Reincarnation. 24. Rigor mortis. 25. Shroud. 26. Terminal. Patient, resident, and client are synonymous terms referring to the person receiving care. Module 16, Death and Dying, Vocabulary Sentences. Acceptance is the final stage of grief when a person comes to terms with their situation and finds peace with dying. Advanced directives are pre-written and signed documents that tell doctors what medical treatment a person wants if they cannot speak for themselves. Apnea means a temporary absence of breathing, which can occur during the dying process. Anger is a normal feeling of great displeasure or hostility that dying patients and their families may experience during grief. Artificial hydration/nutrition refers to providing fluids and food through tubes when a person cannot eat or drink normally. An autopsy is an examination of the organs and tissues of a dead body to determine the cause of death or study disease. Bargaining is a defense mechanism where a person promises to change their behavior to avoid loss, such as, "I'll be good if I can live longer." Cachexia is severe malnutrition and body wasting that often occurs in terminally ill patients. Cheyne-Stokes respirations are an abnormal breathing pattern of shallow breaths followed by deeper breaths, then stopping, often seen near death. Denial is the refusal to accept or believe something, often used to protect a person from painful feelings about death. Depression is a state of sadness, grief, or low spirits that may range from mild to severe during the grieving process. Do not resuscitate, DNR, is an order written by a physician indicating that no extraordinary means should be used when death occurs. A durable power of attorney is a document giving someone the right and responsibility to make healthcare decisions for another person. Hospice care focuses on comfort and quality of life for terminally ill patients and can take place at home or in a facility. A living will is an advanced directive that provides specific instructions for medical treatment or organ donation. A morgue is a place where dead bodies are kept until they are identified or prepared for burial. Mottling refers to spots or blotches of different colors on the skin, usually associated with poor circulation near death. Palliative care is focused on providing comfort rather than trying to cure the disease. The Patient Care Self-Determination Act is a law requiring hospitals to give patients information about advanced directives like living wills. Post-mortem care is the physical care given to a body after death to prepare it with dignity and respect. A prognosis is a prediction about the probable course of a disease and the patient's chances of recovery. Reminiscence involves remembering and talking about events and personal experiences from the past, which can comfort dying patients. Reincarnation is the belief that the soul is reborn into a new body after death, held by some religious traditions. Rigor mortis is the stiffening of the body that occurs several hours after death. A shroud is something that covers or wraps around a deceased person's body. Terminal means there is no reasonable expectation of recovery from an illness or condition.